Disclaimer. This program is intended for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The following program is intended for mature audience only.
Hi, I'm Dr. Kathy Swain Jones.
Hi, I'm Dr. Denise Joseph Zollicoffer.
Hi, and I'm Sonia Williams Finney.
And this is
Menopause Diaries, real talk, real stories.
Hello, and welcome back to Menopause Diaries, real talk, real stories. We are so glad that you have joined us today. If it is your first time, welcome. You're in for a real treat. And if it's your second, third, fourth time, however many times it has been, we are glad that you have chosen to listen again and to join us. And as usual, we're going to share stories with you because we want to make sure that women understand that their stories may not be just unique to them and that it affects others also. So here again, we're talking real talk and real stories. So with that in mind, I'd like to introduce to you my partners, Dr. Kathy Swain Jones. Can you say hello, Kathy?
Hello, everyone.
All right, so that's Dr. Kathy's voice. And then Sonia Finney.
Hi.
Okay, welcome, Sonia. Welcome, Dr. Kathy. And we are joined today by a very special lady who has chosen to bring us into her living room, into her home, into her heart, into her story. And that is Michelle, and she's joining us from Central Florida. So Michelle, welcome to you.
Thank you for having me.
We're really glad that you have chosen to be here with us today and share your story. So you and I talked a little bit, and you have a really good story, and we're excited to hear you share. So would you just start from the beginning and catch us up to where you are today?
Okay, so I've had a journey with my reproductive years where I've developed fibroids as time has gone by, and visit my GYN and have a lot of abdominal discomfort. My fibroids were calcified, like really a number of them with like hard rocks in my uterus. And so that was an issue that we kept monitoring. Along with that, I had anemia to the point where my hemoglobin was down low, like 8, and I was still working. I didn't realize that, okay, this is what was going on. I was trying to climb a flight of stairs and I was questioning, why am I so out of breath? For my age, I was thinking, this is abnormal. I shouldn't be having to sit down when I go up a flight of stairs and just catching my breath as if I'm, in my 60s and 70s. And so we discovered that, yes, I have anemia, and it was because of these fibroids that I had. So I ended up getting iron infusions and correcting that, temporarily. Then my endometrium
Michelle,
lining.
How old were you at that point?
So I would say 30s to 40s, early 40s maybe. And so finally realizing that, okay, my endometrium lining was thicker than it should be. And so the decision was made that the best direction for me to go with a hysterectomy. So I think I was about 30, no, let me think on that. 47 maybe, when I decided, okay, let's go for the hysterectomy. I have too many things going on with this uterus, and I'm over it. I need to be done with this concern. It's been going on. So I was quite on board, let's get it out. And I chose to have everything taken out, the uterus, the ovaries, because I didn't want to have years later another question of if I had something left, then, cancer is a concern that I didn't want to deal with. So I went ahead with a total hysterectomy.
And I thank you for clarifying what total hysterectomy in this case mean for you, which is getting those ovaries out also?
Right. Uh, I didn't really think too much at the time about keep ovaries. I needed the hormones because I was literally just like, I needed everything out, so I didn't really go in depth with the options because I just wanted to be over.
You were tired.
I was tired of it. I wanted to not have this concern I wanted to sleep at night thinking that, okay, I've done everything. I don't have a question whether I have ovaries that are going to cause me cancer. I wasn't going to have any children any further. So that was the direction I took. And at the time, I know I made the right decision. It wasn't as if I was going to do anything differently, but years later, after going through menopause, after realizing the changes that was happening to me, I kind of was feeling sad and felt the loss of my ovaries, loss of my not reproductive ability, but what the estrogen having
The
estrogen
femininity
meant.
what makes us. Did they start you on hormone replacement therapy immediately after the surgery, or did they discuss that?
So I didn't start it because I was also on the fence with, am I gonna have any problems with having breast cancer?
Mhm.
So and so time went by and I never went back to discussion about uh hormone replacement until a few years later, after I've noticed that I felt like I was aging exponentially. I felt like my skin was drying out. I felt as if I had arthritis. All my joints hurt when I get up in the morning, achy. Um, and of course, as time went by, I lost my libido. I didn't, had no interest. Climaxing, having intercourse was not something I cared much about.
Yeah.
And so I kind of felt like, wow, my goodness, this kind of hit me hard now.
Mm.
And I was still a newlywed. I had, gotten married in 2015, and I'm like, wow, I didn't think this thing through, I was telling myself. So that was kind of a shock for me to just kind of own up to, well, this is permanent. And I felt like, man, I wish I had gotten a more in-depth conversation with my GYN to kind of said, well, now you understand, this is what you can expect. And so I don't feel like I really had a complete process to focus on. These are the expected things that might come up. And maybe I didn't do my research because I was so ready to get rid of everything. So,
Well,
it's just
and I
one of
think
those things.
that's key on what you're saying, and especially for a lot of our listeners, is sometimes we put all of the, we would hope that the provider would discuss the pros and cons a little bit more from the perspective of, hey, do you know that this could happen? This is what happens to a lot of women and what this can mean. And I don't think that we do a good job of doing that for a lot of women, and then you end up kind of somewhere where you can't turn back and you just got to
Right.
figure out where you're going, and that happens to a lot of women.
I definitely felt that way because somehow it's just like I felt naive in myself, like, wow, I didn't realize the gravity of all that would happen, the intense night sweats, like pouring sweat, just soaking the sheets, getting up and having to change my whole pajama. And, I would be wet and then I would take the sheets off, but now I get cold and then I got to put it back on. And it
What
was
do
a
you think the amount of
all-nighter.
time was between when you had your hysterectomy and those symptoms really started, where you started thinking, what did I do? Was it 6 months? Was it a year? Was it 3 years?
I would say it was getting worse in about 2 to 3 years.
Mhm.
And like I said, I was putting off the discussion with having hormone replacement, you know, and I really didn't even consider that that's what was going on with me. I knew I was having the hot flashes and the night sweats and headaches and so on, but I didn't really think maybe you should get on estrogen. I just was thinking, okay, it's menopause, you know, it is what it is. But I did end up discussing it with my GYN, and he had suggested, okay, we could try the patch because I was you know,
Mhm.
I was concerned about it causing me high blood pressure because I noticed that I got on the pills, and then I was like, no, my blood pressure is going up. So then I had other concerns, like you know, weighing which one do I really want to deal with, high blood
Yeah.
pressure or hormone situation.
Mm-hmm.
And so I delayed
Mm.
even further.
Mm-hmm.
So I was just dealing with it, and the insomnia also, that was another one. I'm like, is this all menopause, or is it just that what's what exactly is it all? It's so many things.
And you were still relatively young at that point.
Yeah, and I felt sad
Well,
because,
and
you know,
also newly married.
exactly,
No.
that was the kicker right there. It's like,
Yeah.
you know, I want to will myself to be a little bit better at this, and it's
Because
not
you would think
deciding
that,
me.
let's just say you were married 25, 30 years, you still, it's not something you want to happen, but you figure, okay, he'll understand and we'll get through this together. It's just not something you want to, and not as beautiful as you are. Our audience can't see you, but you're absolutely beautiful
Oh,
and
thank
to
you.
have to, it really does, you know, because it's a, I'm damned if I do, I'm damned if I don't, you know,
Exactly.
and
Mhm.
that's very hard. It's a decision
Yeah,
a
it's
lot of
truly
women have to make. Yeah.
it's like a serious heartbreak. It's
Yeah.
really, really that deep. That's just like, my goodness, I can't tell you. So I did end up going back to my GYN because I'm like, something has to change. I feel like I am aging like faster than I should. I don't know what's happening with my whole body, my skin. Something is moving too fast where it has to be this lack of estrogen. And so I said, okay, I'm gonna try the estradiol patch.
Yeah.
So
But
I
you had
did.
been tried on oral estrogen before?
I didn't try it and give it enough time because of my blood pressure.
Okay, I see. I see.
Yeah,
And probably the patch was going to be better for you anyway, because
Mhm.
it's really, when you take the estrogen pill, it's the breakdown in the liver that causes the metabolites that affect blood pressure and blood clotting and even cancers. So the
right.
patch was probably going to be the better one for you. Was there a point you ever felt, I don't know if betrayed would be the right word, by your provider, like you weren't told everything? Is
I
that kind of how you
do.
felt?
So it's not betrayal. I feel like um I feel like I would have benefited from a more in-depth explanation of, let me just go over with you the things that you can anticipate to happen.
Yeah.
I
And
was
give
So
going
for
to
our
ask that.
listeners,
Yeah,
can
I
you
was thinking.
direct this to our listeners? Like if that were you now sitting there with what you know now, how you would have handled that if the provider didn't provide that for you. So
yes, so
yeah.
I actually had a colleague at work that was talking about, you know, having a hysterectomy. And I asked her, like, what are your reasons for it? And she explained her reasons. And it, to me, didn't sound like it was medically necessary. And I said, let me just tell you a few things. So I gave her a good long spiel about, you know, my journey and the things that, you know, I've realized after the fact. And so she's like, okay, I'm going to talk back with my doctor and discuss it further. And she delayed. She decided against it. But she's even a much younger woman than myself.
Yeah.
And this
Yeah.
is exactly why we're doing this. This is exactly why we're having these conversations, is because of people like you who if you hadn't shared with your coworker, she would have. Yeah, and that's not to say that a hysterectomy wouldn't have been the right decision for her, but at least now she was armed with a little bit more information.
And
Absolutely.
one of the things is one of the things that we want to know just as fact wise, our ovaries still kind of produce a small amount of hormone up to about age 65. So you were basically a young woman at 47 having the ovaries removed, and it was like a castration. You had estrogen one day, and then the next day you did not, and your body crashed. And one of the ways that we can help people possibly, or ladies, do that differently is go in and say, and if your provider is not willing to have those conversations, then this is when we always say maybe we should look for someone else. But go in and say, so what does this mean? What options do I have for hormone replacement? And I think that, natural menopause offers something different to the body than immediate menopause. And that's the conversation that you weren't prepared. It was out of trust that you're going to tell me everything I need to know. And if I shouldn't be doing this, you're going to stop me from doing it. But it happens all of the time. And so maybe, especially for young women who, are facing that, is to go in with a list of questions on what are my options? Here are my concerns. What does this mean for my anti-aging, my skin, my hair, my nails, my heart disease risk, my breast cancer risk. Did you have a first degree relative with breast cancer?
No.
Okay, who had breast cancer? And was it somebody not in the immediate family?
No, I had and I don't know if there's a link. My cousin on my father's side,
yeah,
had breast cancer.
So in your case, having those conversations might have given you the information that said, hey, no, at 47, your body's still making hormone, and we can give you a safe replenishment of your hormone by using a topical cream or a patch the same way, because your breast cancer risk really doesn't increase till 5 years after menopause. Let's just say if you continued hormone replacement therapy. So you could have naturally gone into your 50s using some type of hormone replacement, and then with no genetic link to breast cancer, with the topical treatments, you're at very low risk for breast cancer. So that's one of the things that I want our audience to understand too, is that there's a lot of good about being on hormone replacement, and only a select few who have concerns. Those concerns, you can have a pre-procedure plan on what am I going to do with my hormones. And hopefully more providers are validating that that's important. Like, just because we're over 45, we're not done.
Right.
And that probably with some good counseling, you might have even decided to keep your ovaries, really look at the risk for ovarian cancer and breast cancer. And most of those real risks are have a genetic link to them, or there are other factors that could have put them at high risk. So, thank you for sharing that, because that's a critical, that's a fork that a lot of ladies face. Do I or don't I?
Yeah, I think and I think Kathy, you brought up a good point, and I'm just and not trying to bash, men doctors or anything, but I'm just curious as to whether or not, Kathy, you've seen, or maybe you find that you hear more stories like this with women that have like a male gynecologist or anything, or maybe women that are seeing male gynecologists, that maybe they should be the ones that are even more proactive in terms of bringing up, and making sure they have a list of questions to ask the doctor, to make sure, and explaining that where they are in that, period of life. Like you said, she had just gotten married and was a newlywed, and here and now, she has no desire to have, sex or intimate relations with her husband, which, like she said, I mean, I would have been devastated. And I'm just curious too. I just for my own curiosity, How did at that stage, I mean, what was his response to, you going through that process at that point? I mean, for people who are out there who maybe engaged and they're going through menopause right now, or, what is it like, or how do you explain that to your partner? And how was he with that?
So he is very supportive of me in everything,
Mm-hmm.
and extremely patient. And I think more so than anything, he just wants to be there for me in whatever I'm going through.
Mm-hmm.
So I think a lot of times he will. It's always for the good of making sure I'm where I need to be
Mm-hmm.
than anything. And so because of that, I feel like he's putting off what should be a normal thing for us because he doesn't want to add more stress to me.
That's good. That's very good. I'm happy to hear that because, yeah, I'm sure that, and even for myself, I mean, who I'm just, at some point gonna be, getting out there dating and going through menopause, and that's a question that's always in the back of my mind. Like, how do I explain this to someone? I mean, I guess, depending on the age of the individual, but it's always been something that's in the back of my mind as to, how do I explain that maybe, my desire might not always be there or whatever. So, yeah.
Correct.
Have you ever tried any supplements or anything, maca or ashwagandha or anything like that to help with your libido?
No, I really have not done any research. I've heard the names of the stuff you mentioned, but I don't know anything about them.
Yeah. And
So-
are you on the lowest dose of estrogen, the
I
medium
am.
dose, or one of the higher doses?
I think I'm on the lowest dose.
Okay.
And I've been on it less than a year, and I do see improvement in my sleep significantly because I remember I was on trazodone to help me sleep. I no longer take it. And I don't sweat like I did before. So I know that things have improved. But in terms of libido, sexual desire, that is still not where it should be.
Are
Well,
you using any hormone cream at all?
No.
Okay. Now
Dr.
this is
Kathy, tell her a little bit more about the maca root, because I know that you, early on, I attended one of your webinars, even before we started the podcast, and you talked a little bit about it, and I can honestly say that it works. So, yeah, so I mean, and it's like a natural supplement. As a matter of fact, I had to reduce, like the bottle says, take this amount, and I'm like, whoa, because
let me turn the engine down a little bit.
exactly. And I don't even have a partner, so that's like, I'm like, wait, I'm like feeling things that I haven't felt in a long time,
which is a good thing. The other thing too, Sonia, it could be the little regimen we're doing on the outer areas and inside.
Yeah, it could be
okay, so let me just explain explain a generic thought. And what I'm going to talk about, I mean, you'd have to go to your doctor to get these things, but maca root is basically, and for women, what's best for us is the mixed maca root. So the yellow, red, and black maca. Black maca is really good for men because it increases their testosterone. So maca is going to increase your testosterone because we still make some hormones from our adrenal glands. Now, when you have a hysterectomy and your ovaries are completely removed and you went through what you went through, your adrenal glands probably went into overload and then, started failing. You probably had problems with sleep and maybe even anxiety, depression, regulating yourself. So everything crashed. So there's two that might be really good. Ashwagandha increases testosterone by calming the system down. It helps calm the adrenal glands down. The adrenal glands are basically our stress center. And they say, hey, if anything goes wrong, I got your back. And so when your ovaries are removed, they say, well, hey, we need to kind of start kicking out some estrogen and testosterone for her. The problem is, if your body is in crisis, solving the crisis becomes the most immediate solution and not the libido. Libido is the last thing our body fixes. So when you take a little ashwagandha, and I usually recommend just start with one, because if one works for you, wonderful. Maca root increases the production of the testosterone from your adrenal glands. Ashwagandha it helps settle. It's like a hug to the adrenal glands. It settles it down so that you feel more relaxed during relations, and your body naturally starts producing a little bit more of that testosterone. The other thing is that when you take your estrogen, and sometimes that can also increase your when your doses are higher. But one of the things that I want you to consider is if you have any vaginal dryness or dryness on the outside, there's a cream called estradiol, and it's and I like to start with the cream because you can do a lot more with it than, because there's also an insert tablet. This cream is plant-based, bioidentical, so it's like mashing up yams and giving them to you to use. You would use it inside to rejuvenate not only the thinness, but the thickness of the muscles, the thickness of the tissues, and the blood supply. You also can use it outside around the clitoris, and that also rejuvenates the vulva and also the blood supply to the clitoris. Now, what does that do? That means when I'm hugged, blood rushes to where it's supposed to rush, and you feel hugged and feelings. Without the estrogen, the local treatment of the estrogen, and when you're on a small topical, a patch, it's helping cardiovascular, it's helping you sleep, it may be helping you with some hot flashes, maybe your dose could be higher, but it typically, even at the higher doses, it does not rejuvenate the vulva and the vagina. So when we don't have that estrogen stimulation there, you're on hormone replacement, you're sleeping okay, but when you're hugged, it still feels cold down there because there's no blood supply. So adding that hormone cream, and the reason you start with the cream is because you can treat inside as well as the clitoris, as well as rejuvenate the vulva. And in probably for most patients, it's usually 6 to 8 weeks. And when they're hugged or cross their legs, they feel action there. And the reason you don't feel it now is because there's probably atrophy. The clitoris has kind of receded back up into the clitoral hood because of the lack of the blood supply, because of the lack of estrogen. And the other thing is yours is more significant because you were 47 with hormones raging, and hormones rage when we have fibroids. That's what feeds fibroids. So you went from a extra hormonal state to none at all. So now look at the fact that if you use something like the hormone cream, you're reestablishing, you're sending blood back into the clitoris, and it grows, and the tissue and the moisture glands. And I've said before on some of our podcasts, I have women in their late 80s still sexually active, very proud of it, and their vaginas look 25 on the inside. And it's just, it's something that we should talk about, because with the way that healthcare is now, the visits are very limited, and the doctor's not going to bring it up if you don't bring it up. And if you do, most doctors still are not, they have so many other things to worry about that, your vaginal health, if you don't mention it, they're not going to mention it to you. So just for you, adding some maca, yellow, red, and black, and you can put it in a smoothie every day. You could, just put it in some water and drink it. If you're a little anxious, adding a little ashwagandha. And these are all you can get from a supplement store. Yeah. Okay. And then adding the estradiol vaginal cream to the clitoris and then to inside the vagina. And again, you have to get that prescription from your doctor and make sure your doctor agrees. But it is the safest form of estrogen because it doesn't absorb into your system. So there's no competition between your patch and the cream. It's only additive to you. And what happens is we rejuvenate all of this, but she doesn't get anything.
Right.
So
Well,
Michelle,
thank
yeah,
you. You
no, so
tell your husband you can send the flowers and chocolates to Sonia. I usually tell my
Thank
patients,
you.
you tell your
so
husband
yeah,
you can send the flowers and chocolates to my office, but have them send to Sonia because that's
so yeah.
great.
Absolutely.
So I'm
Absolutely.
the menopause poster child, but I'm also
Yeah.
the guinea pig. So I can
That's
say,
right.
and I can attest to the ashwagandha. I actually don't take ashwagandha because I take a couple other things that have a little bit in it. So I don't actually take the ashwagandha. But I mean, if you don't have it, then like Kathy said, it would be great. I do use the estradiol cream and I've been using it, and I actually have started using it differently, just as Kathy just said. But I'm gonna tell you, the maca root, girl, I cannot tell you enough. And I take a pill. So I take the triple maca root and
Yeah.
I use it as a pill.
Yeah.
And the supplement that I have, I mean, I think it said something like you could take, I don't know, I should grab the bottle. I'm looking at it across the room, but I can't see. But it,
Sometimes you can take like 3 of them,
yeah,
but if
it
one
does.
of them's
But I'm
working, keep
telling
yourself at
you,
1 and you move up if you need
telling
to.
you, I was like, no, I never took 3 to begin with. I took 2, but girl, I'm telling you, I'm like looking at a guy. I'm like, you walking and you see a guy. I'm like, ooh, he's like cute. Oh
Because
my
you know
God,
why?
what's
You know
happening?
why? You're getting blood flow where you
Girl,
need
but I
to
had
have
not,
blood
this
flow.
is foreign to me. I'm
That's
talking
right.
foreign for like 10 years.
Yeah.
And I
Yeah.
was like, what just happened?
Yeah.
And
Yeah.
but I mean, I was excited. So I just take like one, and I don't even take it every day because I'm telling you, because
And you
it's
don't
like
need to.
the
You
feelings
titrate
come
it. So
up, but if you
if
don't have it,
3 times a week works for
yeah,
you, do that. And then when you start feeling, oh, maybe
seriously,
I need to up it, then you increase it. But
yeah,
that's
like,
the way to kind of start building some natural things into
yeah,
your regimen,
yeah,
because the natural products can take you all the way till 112,
yeah,
what God says. So,
girl,
and
yes,
men can take maca also. So,
yeah.
you can make your 2 little smoothies in the morning, and
Woohoo.
if
I,
there's any
I'm
need for that.
I'm really happy you guys are sharing this because and the thing is, it's not something we talk about
That's right.
much, at
Yeah.
all. And you're right, it's not something I've had the opportunity to sit down and discuss thoroughly with my doctor. I'll just tell him, like, I have no libido and that's it. But hearing that there are options there, and this is not the end of the world for me, I am excited. I am looking forward to it, and my husband deserves it.
That's right.
Yeah,
And don't be
absolutely.
surprised if your doctor, especially if it's a male, doesn't know anything about that or
Right.
discounts it like that stuff doesn't work. And I would say to anybody who may have a provider like that, just look around for especially providers who also do holistic medicine or functional medicine, because that is a deeper look into how the body works and what are the things that just from our lifestyle that we can provide for it to work correctly, and not just take this medicine or there's nothing I can do about it.
Right. So do you think that
Hey,
question is, like I said, I'm on the very low dose of the estradiol. I might be able to move up to a higher dose and add the ashwagandha and the maca, to kind of.
well, your issue is going to be your high blood pressure. So
Mhm.
your
I
issue
have
is
high
going
blood
to
pressure
be
too, so it's not affected me.
good. So your issue is going to be if I go higher on my estrogen. But here's the thing. So because I'm a board certified gynecologist, but I also do functional medicine, which really treats things at the root, not the symptom. I'm not
Mhm.
giving you something for your hot flash. I'm redoing your body so you don't flash. So in your case, you have to, if the patch is going to cause your blood pressure to be elevated, some of the things that people do, believe it or not, that in our microbiome, our gut controls how our body responds to even our blood pressure, our cholesterol, whether it's up or down, our insulin resistance. And so we take a look in that, and strategically based on those results can rebalance for your body not to have those responses.
Yeah.
Whereas when you go to the doctor now, if your blood pressure is up, you have 2 options. increase your blood pressure medicine or take you off the hormone replacement. And we don't want that.
Actually, so far, I'm not having any issues with my blood pressure right now.
Oh, okay. I thought you did.
Great.
Okay,
On
maybe
the
that's
patch.
just my little Sonia over there, my little sweet child who just it checks all the boxes.
Yeah.
Okay, so
yeah.
great. If you're not having any problems with your blood pressure, then I would go and talk to your doctor and maybe suggest if you're on the lowest. How old are you now?
I am 55.
Okay. If you're on the lowest dose and you've been on it, it's safe for you to stay on it, because the safest person who can take it for the rest of their life is the person who started it right at menopause or within 10 years of their menopause. And so like once you get over 60, and if you hadn't had a hormone replacement, you can't take it. But one of the things would be to consider is bumping you up just a little bit. And then if you're going to start ashwagandha, you only start one thing at a time. So
Correct.
if you're going to bump up your hormone, bump that up, get where you're, okay, I'm good there. Or if you say, well, no, let me go on and try the maca. Start with the lowest dose. If it's a capsule, start with one. If it's the maca root powder, you'd start with a half a scoop or a fourth of a scoop and work your way up to, but you never do all three of them at one time, because if you have a reaction, you don't know which one it actually caused the issue. But I would say at 55, well, the thing is with your blood, oh, you don't have blood pressure. Where did I get blood pressure from?
No, I do.
And
I
she
do.
won't.
Yeah, I am taking amlodipine, a low dose amlodipine for my
Okay.
blood pressure. But
That's
what
what
I'm
I
saying
take
is that
too.
my
We have a
pat-
lot in common. I take
Yeah.
amlodipine 5 milligrams.
exactly, and
Yeah.
so it's controlled.
Okay.
So you're basically the estrogen didn't increase it any.
No,
right.
not with the patch.
Yeah.
So
And
when
then
you make that
don't
decision is if you just have one thing you're trying to like, let's just say, I'm not having hot flashes. I'm sleeping through the night. I want my libido back. I want my skin moisture. I want my hair moisture back. Then you work on the other things that you can do to bring those back, because just by also calming your adrenal gland down, that will help you produce a little of your own natural estrogen as well, and balancing your microbiome. So
Gotcha.
one of the things is I would maybe start with the doctor, just go in and talk to them about maybe bumping you up to the middle dose if it's okay.
Right.
And try to get on, just because you can go to that middle dose and go that for a few years, and then towards 60 start coming down to the lower dose.
Okay.
And that's assuming you're not on the 0.5, you're on the 0.375, something like that.
I believe it's 0.5.
Okay. So yeah, if you're on that might be, I would talk to your doctor definitely about that. If the answer is no, then you start with the maca, get that. And I think that'll get
my
you.
recommendation.
And I would ask for the estradiol vaginal cream,
Yeah.
and use that on the outside, on the inside. Let me tell you the reason is that the majority of women who come to me and their major concern about their perimenopause or menopause is their libido. I will say to them, let's try, and they've been, menopausal for 3 years or more, or, suffering with low estrogen for 3 years or more. I will say to them, let's start the hormone cream, especially, they're dry, sex is painful, and no libido. We start the hormone cream inside and around the clitoris. And I say to them, let's give 3 months. And if your libido is not back when, then we can maybe consider you using a patch. And I would say 99% don't come back for problems with the libido. So just by adding that replacement there may put you exactly where you need to be.
All right, so I have a question about the estradiol cream. So application of the cream is nothing to do with timing of intercourse, correct?
Correct. It's going to be something that, usually we do depending, and you talk to your doctor, but you could do like a loading dose to kind of get yourself rejuvenated, over a 7 to 10 day period. And then it's just a maintenance dose of it's probably about this much, twice a week. And you would just put it in twice a week, and treat the outer area twice a week. and it maintains it rejuvenates you, and it maintains those results. And let's just say you're unable to have relations because it's so painful, and a lot of women are shut down because it's so painful. We do the loading dose with those, but you and your doctor will, or your provider will discuss if a loading dose is appropriate or just starting on a maintenance. And it would be something that you would continue as long as you wanted to, remain sexually active. Once you stop it, the atrophy comes back again, the thinning, the dryness, the blood goes somewhere else because it's shut down.
Got it. Thank
Kathy,
you.
I know.
I have a question, Kathy. For our listeners who may be out there who says, okay, you know what? Now I'm 62 and I've met Mr. Right and I want to start being sexually active. I've never been on hormone replacement therapy. Is that someone who would be safe to start on, say, the estrogen cream at that age?
Yeah. So the estrogen cream you can start whenever because there's no systemic absorption. The good but the topicals and any other form of estrogen replacement we don't recommend because the studies do show that if you don't start it before 60, you actually increase your risk for some of the side effects or problems with hormone replacement. But if you're needing it just for libido, you don't need it because you would do the treatment around the clitoris, you would do the vaginal treatment, and that gives if you use it regularly and you tolerate it and have no problem, which most women do, you will have a complete rejuvenation if you use it, that twice a week like you're supposed to. So anybody can start that whenever they're ready. As long as, again, they don't have some kind of, because it does not absorb into your system. So having high blood pressure, you don't have to take progesterone with it because it doesn't affect the uterus. It's considered a local treatment for the bladder and for the vagina. And not only do we use it for libido, we also use it for leaking, urinary urgency,
Yes.
gotta go. It helps with all of those symptoms because that's a manifestation of just weak muscles. And so a 62-year-old may feel like, I really want all of those benefits. They can take it.
All right. Thank you so much for answering that because I know there's someone out there thinking about exactly what I've asked. So,
Absolutely.
Yeah,
And there's a lot of women
common
out there who
question.
want to stimulate their libido and they're dry and painful and may have never heard that they don't even have to, let's just say they're concerned about a remote history of breast cancer. That would be the way to go because then there would be no risk using the hormone replacement.
Because it's not absorbed into the system.
It's not absorbed.
Right.
I know, Kathy, you hate when I say this. The only downside that I see is, and I use it, that I definitely use it for all of the reasons that you just mentioned, but is that it's messy.
Okay, let me give you something for that.
So messy, Michelle. I'm just letting you know it works, but it's messy.
You were on the starter program.
Yeah.
Now you may have graduated because once you start getting some rejuvenation, we can switch you over to, it's a small tablet about the size of an eraser that goes in. And now, if you just started with that, you would not have had all of the rejuvenated effects of the vulva, the clitoris, and the vagina. So I always start with the hormone, with the cream. And now we can just send a little prescription in for a big girl prescription now for using the little tablet. I mean, it's literally the size of an eraser. You put that in twice a week, and then you still would have your hormone cream, and you'd use that. So on your treatment night, your little tablet goes in, and your cream goes on the outside, and you're good to go.
Okay.
Now, I did want to say this too for all of the women who are having vaginal dryness, because we're on that. Hormone replacement is not the only thing. There's pure organic coconut oil that women can use the same way. You can use it on the outside, and you can even make coconut oil suppositories. But with the Amazon tray from Amazon, get the suppository trays, just melt it and then put it in the refrigerator. So there are options also that are very natural for women who may have breast cancer, but who are looking for answers for vaginal rejuvenation without the hormones.
I really like the coconut oil. I usually just make a joke of it when I talk to my patients. I'm like, cook in the kitchen and cook in the bedroom, and that usually goes down very, very well. So they're usually willing to
who
try
doesn't
it.
like the smell of the coconut oil? So
That's
Yeah.
you can put a little behind your ears and say, honey, come here, So
It's that come hither coconut oil
hither.
smell.
What is that, darling?
Oh. So Michelle, anything else that you would like to share with us, or any other questions?
This has been absolutely a very wonderful meeting. I'm glad I was able to get your time and your expertise, and I'm feeling very hopeful and excited.
Mm-hmm.
I'm just really joyful that I've gotten a lot of questions answered, and I feel better about this not being the end of it for us, myself and my husband. So thank you so much.
Yeah,
I'm glad
you.
that you felt like, and I'm here, like, I don't know if you can see, but girl, I'm telling you, get the maca root. I'm telling you.
Sonia, you're like
Absolutely.
the advertisement for maca.
No, I'm serious, girl. I'm telling you, but I think, yeah, I'm telling you, yeah, I think it's great.
I'm glad that we could add value to you, because you certainly have added value for our audience,
Yes,
to
for
hear your
sure.
story, and to the way you've navigated through, and now to know that there's other things that your story will allow women to maybe get that help a few years before you're now being able to get it. But the good news is you'll catch up in just a few weeks, so don't worry.
Oh,
Yeah.
thank you.
Michelle, you can let us know later on outside of the podcast how you're doing in a few months.
I'll give you guys an update.
We'd love that. We'd love that.
Very good. I'd almost love for you to come back on again and let us, if you're still having problems with that restless leg syndrome, because I know that's been since you're 30 years old. It would be great, and it maybe even more now that you're in your menopausal years. It would be great to kind of dissect that and show you how maybe there are answers for you on that have been overlooked, like a lot of the other things.
Yeah, I'm gonna be signing myself up for.
Very good. Go to my website. I'm doing free consultations, to kind of get to know you and see what I can let you know how I can help you, and we can get you set up. And because that has to stop. The restless leg. We're gonna have you all jewed up, but then you still got to kick that leg out of the bed.
Exactly.
We need to fix that as well.
Yeah.
Oh, you just she's gonna be a new you. Tell him, honey, just wait. I'm coming back.
Yes, absolutely. He's been patient long enough.
I'm happy to hear that some of the anxiousness that I felt about dating and getting back into relationships. So thank you for sharing that.
Absolutely. Yeah.
Kathy, when I look you up online and put in Kathy Jones, I get someone else. How should
Remember
I find
I told you Swain Jones. Swain Jones is my
Right.
Swain Jones is my professional name. Instagram is Dr. Kathy Jones, and it has all the information, the link to get to me and my business.
Okay, great.
Yeah.
And this has been really, really rich. Michelle, I am so grateful. We're so grateful. Women of the world are so grateful for you sharing your story. Ladies, anything else you'd like to share?
No, I'm just so happy that all of the young ladies coming behind us, how blessed they will be from stories like, our guests. Yes, like Michelle, and that this is just going to change the face on how we were ashamed. And the ladies coming behind us will have options, and one patient at a time.
Right. Yep. Well, thank you again, ladies. I appreciate the time that you've invested in me. And I'm really overjoyed that I have a better prospect. Thank you.
Yes.
Thank you again. And I want to hear what your husband thinks.
Yeah.
All right. Definitely.
All right, my dear. So nice meeting you.
This is Menopause Diaries, real talk, real stories. Thanks for for listening. Let's thrive together through every
Hot flash.
mood swing and sleepless night. Don't forget to like, share, and subscribe to Menopause Diaries, Real Talk, Real Stories. If you have questions or want to share your story or would like to be a guest, visit us on Instagram at Menopause Diaries Podcast. Let us start a conversation and navigate this journey together.